Bowel cancer is a serious health issue affecting people worldwide. It is a type of cancer that begins in the large bowel, which is part of the digestive system. The large bowel includes the colon and rectum, and cancer in these areas can have significant health impacts. Early detection and treatment are crucial for improving survival rates. It's the fourth most common cancer in the United Kingdom. Each year, thousands of new cases are diagnosed, making it a major public health concern. The statistics are alarming, and they highlight the importance of awareness and education about this disease. Worryingly, we're seeing a rise in cases, especially among younger adults. Traditionally, bowel cancer has been more common in older adults, but recent trends show an increase in younger populations. This shift is concerning and suggests that lifestyle and environmental factors may be contributing to the rise. This trend is concerning and highlights the need for preventative measures. Healthcare professionals are working tirelessly to understand the reasons behind this increase and to develop strategies to combat it. Prevention and early detection are key components in the fight against bowel cancer. We need to understand the risk factors and what we can do to protect ourselves. Risk factors for bowel cancer include age, family history, certain genetic conditions, and lifestyle choices such as diet, physical activity, and smoking. By identifying and addressing these risk factors, we can take steps to reduce our risk. There are many factors that can increase the risk of bowel cancer. These include age, family history, and lifestyle choices. Maintaining a healthy weight, eating a balanced diet, and staying active are crucial. Regular physical activity helps to keep the digestive system healthy and can reduce the risk of developing bowel cancer. And staying active are crucial. Engaging in regular exercise, such as walking, jogging, or yoga, can have a positive impact on overall health and reduce the risk of bowel cancer. Additionally, a diet rich in fruits, vegetables, and whole grains can provide essential nutrients and fiber that support digestive health. Additionally, emerging research suggests that vitamin D might play a role in reducing bowel cancer risk. Vitamin D, which can be obtained from sunlight, certain foods, and supplements, is believed to have protective effects against various types of cancer, including bowel cancer. Ensuring adequate levels of vitamin D through safe sun exposure, diet, and supplements may be a valuable strategy in cancer prevention. Professor Justin Stebbing, a renowned oncologist, has been studying the link between vitamin D and cancer. He suggests that maintaining sufficient vitamin D levels could potentially reduce the risk of developing bowel cancer. This is an exciting area of research that offers hope for new preventative strategies. Professor Stebbing's research highlights the importance of vitamin D in regulating cell growth and reducing inflammation. These are key processes that, when disrupted, can contribute to cancer development. While more research is needed to establish a definitive link, the potential benefits of vitamin D in bowel cancer prevention are promising. Vitamin D is a unique nutrient. It acts more like a hormone in the body than a vitamin. It plays a crucial role in various bodily functions, including calcium absorption for strong bones. But its benefits extend far beyond bone health. Vitamin D supports the immune system, helping it fight off infections and diseases, including cancer. It also regulates cell growth, preventing abnormal cell division that can lead to tumor formation. Additionally, vitamin D possesses anti-inflammatory properties, reducing chronic inflammation that can damage cells and increase cancer risk. The primary source of vitamin D is sunlight. When we spend time outdoors, our skin absorbs the sun's UVB rays. When our skin is exposed to UVB rays, it synthesizes vitamin D. This process is essential for maintaining healthy bones and a robust immune system. However, several factors can influence how much vitamin D our skin produces. These include the time of day, the season, geographical latitude, and even the pigmentation of our skin. For instance, during the winter months or in regions far from the equator, the sun's rays are not as strong, making it harder for our bodies to produce vitamin D. In addition to sunlight, we can obtain vitamin D through certain foods. Oily fish like salmon, mackerel, and tuna are excellent sources of this vital nutrient. Egg yolks also contain vitamin D, making them a valuable addition to our diet. Furthermore, many foods are fortified with vitamin D to help us meet our daily requirements. Common fortified foods include milk, cereals, and some plant-based milk alternatives. Despite these dietary sources, it can be challenging to obtain sufficient vitamin D through food alone. This is especially true for individuals with dietary restrictions or limited access to vitamin D-rich foods. Therefore, supplements are often recommended, especially during winter months or for individuals with limited sun exposure. Vitamin D supplements can help ensure that we maintain adequate levels of this crucial nutrient, supporting overall health and well-being. For those who spend most of their time indoors or live in areas with minimal sunlight, taking a daily vitamin D supplement can be particularly beneficial. It's always a good idea to consult with a healthcare provider to determine the appropriate dosage for your individual needs. Section 5. The vitamin D debate: evidence from clinical trials. While observational studies have shown a correlation between higher vitamin D levels and reduced cancer risk, randomized controlled trials, or RCTs, have yielded mixed results. Some RCTs have shown a protective effect of vitamin D supplementation, while others have not. The inconsistency in findings could be attributed to various factors such as study design, dosage, and participant characteristics. More large-scale long-term RCTs are needed to provide conclusive evidence regarding the effectiveness of vitamin D supplementation in cancer prevention. Section 6. Expert Opinions. Cancer Research UK weighs in. Cancer Research UK, a leading cancer research and awareness organization, acknowledges the potential benefits of vitamin D, but emphasizes the need for further research. They highlight that while vitamin D might play a role in cancer prevention, it's not a guaranteed solution. Cancer Research UK recommends maintaining adequate vitamin D levels for overall health and well-being, but advises against relying solely on supplements for cancer prevention. They emphasize the importance of following established cancer prevention guidelines, such as maintaining a healthy weight, eating a balanced diet, and avoiding smoking. Section 7. Striking a balance. Finding the right vitamin D intake. The recommended daily intake of vitamin D varies depending on age, health status, and individual needs. It's essential to consult with a healthcare professional to determine the appropriate dosage for you. Excessive vitamin D intake can be harmful, leading to a condition called hypervitaminosis D. This can cause calcium buildup in the body, leading to kidney stones, bone pain, and other health problems. Therefore, it's crucial to avoid exceeding the recommended dosage without medical supervision. Section 8. The bigger picture: vitamin D and overall health. While the debate over vitamin D's role in cancer prevention continues, its importance for overall health is undeniable. Maintaining adequate vitamin D levels is crucial for strong bones, a healthy immune system, and optimal cell function. Furthermore, studies have linked vitamin D deficiency to an increased risk of other chronic diseases, including heart disease, type 2 diabetes, and autoimmune disorders. Therefore, ensuring sufficient vitamin D intake is essential for maintaining optimal health and well-being throughout life. Section 9. A simple step for a healthier future. In conclusion, while more research is needed to fully understand the link between vitamin D and bowel cancer, maintaining adequate levels of this essential nutrient offers numerous health benefits. Vitamin D is not just a single-purpose nutrient, it has a multifaceted role in our body. It is essential for the absorption of calcium, which is crucial for maintaining strong bones and teeth. Without sufficient vitamin D, our bones can become thin, brittle, or misshapen. But the benefits of vitamin D extend far beyond bone health. From supporting our immune system to regulating cell growth, vitamin D plays a vital role in keeping us healthy. It helps our body fight off infections and reduces inflammation. Moreover, vitamin D is involved in the modulation of cell growth, neuromuscular and immune function, and reduction of inflammation. It also influences the expression of genes involved in cancer development. This makes it a critical component in our defense against various diseases. Incorporating vitamin D-rich foods into our diet, enjoying safe sun exposure, and considering supplements when necessary are simple yet impactful steps we can take to support our overall well-being. Foods such as fatty fish, like salmon and mackerel, egg yolks, and fortified foods like milk and cereals are excellent sources of vitamin D. Spending time outdoors in the sunlight also helps our body produce vitamin D naturally. However, it's important to balance sun exposure with skin protection to prevent harmful effects from UV rays. Remember, a healthy lifestyle, including a balanced diet, regular exercise, and adequate vitamin D intake, is our best defense against chronic diseases like bowel cancer. Regular physical activity not only helps maintain a healthy weight, but also boosts our immune system and improves our mood. Consulting with healthcare professionals can provide personalized advice on how to maintain optimal vitamin D levels and overall health. By taking these simple steps, we can pave the way for a healthier future for ourselves